and welcome to the Hands Together podcast series, where we aim to promote dementia literacy among carers of people with dementia. I'm Gloria Corazza, one of the partners of the Hands Together project, representing ISRA, an Italian public senior care provider based in Treviso, Italy. Today I'm here with Christine Koch, a psychologist of ISRA, and we are going to talk about recognizing early signs and symptoms of dementia. Hello, Christine, and welcome. First, would you like to tell us a little bit about your job as a psychologist?
Hello, Gloria, and thank you for this invite. I work as a psychologist and an assisted living resident in units dedicated for people with dementia. In my job, I am involved in several tasks such as psychological interventions and support for residents and family members, as well as for co-workers for management of work-related stress. Moreover, I conduct periodical neuropsychological screenings and observations, assessment and psychosocial interventions for the well-being and better quality of life of the residents. On top of that, periodic team meetings for clinical cases discussion is another important part of my job.
And we all really value the important jobs that you do with other adults. Thank you for accepting to participate in this podcast. And the first question that I would like to ask you is, which are the cognitive functions that are compromised in the early stage of dementia?
The early cognitive functions compromised in dementia primarily involve memory, executive functions such as planning and problem solving, language, orientation, attention, and judgment. These cognitive impairments reflect damage to specific brain areas depending on the type of dementia, with symptoms varying accordingly. A person showing first symptoms of dementia usually appears as more forgetful than usual, shows difficulties in remembering recent events or recently learned information, and especially forgets future plans and events. These are the first signs of memory deficits in dementia, and they are typical of Alzheimer's disease, but less so in other types of dementia. Forgetfulness may also appear in the form of disorientation and confusion. For example, when the person goes out of the house and gets lost, even in familiar places, and has difficulties following directions and recognizing landmarks. Another typical symptom could be struggling to follow complex conversations or storylines, or struggling with finding the right words during conversations. These are attention and language deficits that may occur more often in vascular and frontotemporal dementia. Speaking of frontotemporal dementia, other typical symptoms could be radical changes in behavior and personality, manifesting, for example, with disinhibition and struggling with maintaining a socially appropriate behavior. At the same time, the person could be more impulsive or more easily irritated or even apathetic and totally disinterested. In general, often complex abilities such as ability of problem solving, planning, and following complex instructions are impaired in the early stages of dementia in every type of dementia. This may be evident especially in tasks like managing finances or even following a recipe or cooking without following a recipe.
Interesting. So if I understand correctly, there is not a fixed list of symptoms, but different kind of dementia affect differently, and in a more general note, every person is affected differently from dementia. So what if someone recognizes some of these early signs? What exercise would you recommend?
Some example of cognitive stimulation exercises that can be done both in a group setting or individually could be solving crosswords and puzzles, painting, drawing, and other creative activities, reading books, magazines, or newspapers, and sharing stories or making up stories, for example, using prompts like Story Dice. Also participating in group activities such as group discussions of past times, or playing bingo or even cards with friends. Regarding physical activity, recent research as well as guidelines of the World Health Organization recommend practicing about 150 minutes per week of moderate physical activity. This, of course, can be broken into shorter sessions daily. It is best to tailor the exercises to personal preferences and abilities to keep them enjoyable and sustainable. Some examples of physical exercises are walking, dancing, seated exercises, and even houseworks or gardening. Moreover, the best overall effect on brain health is gained when combining physical activity, mental stimulation, and social engagement.
Okay, so physical activity, mental stimulation, and social engagement. This seems to be the well-being recipe. In the early stages of the disease, how do the first behavioral changes manifest themselves? And how should a caregiver manage such cases?
In early stages of dementia, because of the initial cognitive difficulties, the person may become, on one hand, more easily frustrated, impatient, or temperamental than before. For instance, a person may have difficulty remembering how to perform a routine task, or remembering a name, a specific word, leading to outbursts of anger and impatience. When this happens, it's important for caregivers to provide reassurance and avoid taking over, answering instead, or responding with frustration themselves. On the other hand, previously active individuals may lose interest in hobbies they once enjoyed, refuse invitations to social events, or quiet themselves in the presence of others. In this case, the caregivers could encourage participation by keeping activities simple and familiar, offer gentle encouragement rather than focusing on achieving the specific goal. Moreover, social events could be overwhelming, especially when interacting with people constantly asking questions and remembering names, faces, events. And the person showing early signs of dementia might be afraid of forgetting something, saying or doing something wrong. In response to this, it is possible to create smaller, more intimate settings that can make socializing less overwhelming. Other typical behaviors that come as a consequence of forgetfulness are forgetting appointments, misplacing items, or asking the same question in a short period of time. Memory aids, calendars, and use of labels are useful tools for preventing a feeling of frustration and anger. Along with the fear of losing the memory, it may happen that the person hides objects and then accuses others of stealing their personal belongings or accuses them of plotting against them. In response to this idea, the person can also start hoarding objects and not recognize this behavior. Especially in this case, it is important to stay calm and not take accusations personally. Instead, validate the emotions and provide reassurance. For example, by saying something like, "I understand that you're worried about your things. Let's check together to see if everything is in place." Some behavioral symptoms may also respond positively to pharmacological treatment. It is helpful to consult specialist physicians to receive support in managing these symptoms and to understand which pharmacological and non-pharmacological interventions could be of help. It is normal for caregivers to feel a sense of helplessness and frustration. Turning to a professional does not mean delegating to others, but rather providing even more appropriate help to your loved one.
Well said. And how can one communicate effectively on an emotional level with someone that is experiencing these early symptoms?
When interacting with a person with early symptoms, it comes naturally wanting to correct or clarify when another person says something it isn't quite accurate. People at this stage are frequently still aware of their cognitive decline and may be doing everything in their power to hide it or to compensate for it. So being corrected, even gently, can feel like a painful reminder of what they are losing, leading to frustration, embarrassment, and withdrawal. To communicate effectively on an emotional level, it is crucial to shift our approach. Rather than focusing on objective facts, the emphasis should be on validation and connection. If something a person says doesn't match reality, consider whether it's necessary to correct it. Most of the times, it isn't. What matters more is acknowledging the person's emotional experience and responding to the feelings behind their words. For example, when the other person gets confused or forgetful, they may feel unsafe, scared, or in need of reassurance. In early stage dementia, emotions such as fear, anger, or sadness often mask underlying needs or unresolved issues. These emotional reactions might stem from fatigue, overstimulation, changes in routine, or the frustration of struggling to find the right words. Sometimes just sitting quietly with the person, listening with patience and curiosity, and gently exploring their thoughts or feelings can bring clarity. Once the emotional need is acknowledged, you can often help diffuse a tense moment by redirecting their attention to something familiar like a picture, music, or going out for a walk. These sensory or emotionally resonant cues can re-establish a sense of safety and connection without needing to rely on reasoning or factual correction. Additionally, nonverbal communication plays a powerful role. Maintaining gentle eye contact, speaking in a calm and reassuring tone, often offering a warm smile, can be just as meaningful as the words you choose. People with early dementia are often very sensitive to emotional cues, even as verbal reasoning begins to decline. By showing empathy through your body language and tone, you create a safe, emotional environment where the person feels supported.
And what if someone is a caregiver? How can she or he deal with these changes? What is the best way to respond?
First of all, it is important to recognize that the aforementioned changes are part of the condition and not a personal attack to the caregiver, and they are not intentional. So keeping this in mind might sometimes help in the caregiver mitigate feelings of anger and frustration that often occur. Also, prevention of frustration and confusion is key. One option would be maintaining a routine and structure by establishing consistent daily schedules for the various activities of the day. So specific time for meals, for hygiene, for sleep, but also going to the church or to a familiar shop. Moreover, especially in early stages of dementia, caregivers need to find the right balance between promoting independence and ensuring safety. Too much supervision can make the person feel watched and insecure and incapable, but too little can be dangerous. That's where environmental adaptiveness and environmental cues really help. For example, clear written notes, picture labels, or even color coding objects around the house can support memory and orientation without constant intervention. These tools can gently guide the person through their day with preserving their autonomy. Finally, caregivers should not forgive themselves in the process. It is not easy and neither expected to always be able to respond appropriately to behavioral and emotional changes. So understanding and accepting personal limits, along with asking for help when needed and taking breaks, is crucial.
Okay, well said. Once these early symptoms appear, who could a caregiver turn to? Which are the professional figures involved in dementia care? And where shall they go for the initial diagnosis? Which local care and assistance service could be contacted?
So the first point of contact in most countries are general practitioners. They assess initial concerns, perform basic health checks, and refer patients for specialized assessments, such as memory clinics or specialist centers for comprehensive assessment, where there could be specialists like a neurologist, a geriatrician, a neuropsychologist, and a psychiatrist. Usually, diagnosis of cognitive decline include a neuropsychological evaluation, biochemical and structural investigations. At the same time, the general practitioner can refer the family to the social worker. They will assess social needs, connect families to community resources, and support care planning, give financial and legal advice. The specific care and assistance varies accordingly to the local area where the person lives and may be very different even in the same country. In general, professionals involved in dementia care, along with doctors, nurses, and nursing aides, can be psychologists, physiotherapists, speech and language therapists, and educators. The best type of care is granted when all these professionals are involved, but because there is a multi-professional and integrated vision of the person.
Good. We know that people often use internet to find information, also on very sensitive topics such as diagnosis of dementia. What could you say about the proper use of information found in the internet?
When people use the internet to find information about dementia, including sensitive topics like diagnosis, it is crucial to approach the online information with caution and critical thinking to ensure accuracy and avoid unnecessary anxiety and misinformation. The best way to be sure of getting proper information is to navigate mainly government, research institutions, or recognized organizational websites. These can help the person get some basic information and knowledge on the disease and guide on how to get proper help. On this note, it is possible to find online some cognitive tests that mimic or replicate the ones used in cognitive screening assessments. It is important to remember that these tests available online are only indicative and may not correlate with the results of scientifically validated test batteries and in-depth neuropsychological assessments conducted by professionals.
Okay, thank you. I have one last question for you. If after the appropriate investigation the person receives a diagnosis of dementia, how can a caregiver communicate the diagnosis in a family context, and or even to the person himself that is experiencing these symptoms?
This is a very important question, and it is complex to answer in a definitive way. Communicating the diagnosis to the person who is ill is a delicate but very important process. It must be calibrated and adapted based on the person's cognitive and psychological resources. It is necessary to identify a calm setting and take the time to welcome possible questions, provide explanations, and offer reassurance. For most people who are ill, knowing the diagnosis allows them to gain clarity and make sense of the feeling that they are losing something, the feeling of confusion, insecurity. Knowing the diagnosis may also help allow the person to plan care choices in advance and take an active role in managing their illness. Psychological support may be helpful to assist the person during this delicate time. Family communication also requires dedicated space and time. Dementia is often referred to as a family illness because it brings a series of significant changes to the family network, relational, emotional, and also organizational. Informal caregivers need information about the illness, knowledge on how to manage its symptoms, and psychological support to cope with the emotional consequences that the illness inevitably brings. Above all, informal caregivers need not to feel alone and to have both formal and informal figures that they can turn to for help when they need it. Loneliness and isolation are two of the factors that worsen the quality of life for both the person and the family. It is therefore important to create a support network that helps the person and the people not to feel alone.
That's a wrap for today's episode, where we discussed how to recognize and manage early signs and symptoms of dementia. Thank you, Kristen, for being with us.
Thank you.
Thank you to our audience for tuning in. And don't forget to watch out for other episodes of the Hands Together podcast series coming out.